Dear fellow humans, sometimes prolonged weeks of stress lead to physical, mental, and emotional exhaustion, where every action seems tiring, a burnout. The cynicism, depression, and lethargy that are characteristics of burnout most often occur when a person is not in control of how a job is carried out, at work or at home, or is asked to complete tasks that conflict with their sense of self. Equally pressing is working towards a goal that doesn't resonate or when a person lacks support. If a person doesn't take responsibilities to match a true calling, or at least take a break once in a while, they could face burnout. So, how do you know if you're burned out? Physical and mental exhaustion, a sense of dread about work, frequent feelings of cynicism, anger, irritability are key signs of burnout. Those in helping professions, such as doctors, may notice dwindling compassion towards those in their care. Feeling like you can no longer do your job effectively may also signal burnout. Jobs aren't the only source of chronic stress that causes burnout. Parents, partners, and non professional caregivers can also experience endless exhaustion, feeling overwhelmed by their responsibilities. Is burnout depression? Burnout and depression are two distinct psychological experiences, although they can share some overlapping symptoms. Burnout often occurs due to chronic work related stress, such as feeling overwhelmed, lacking control, or experiencing a lack of support. Depression, on the other hand, is triggered by a wide range of factors, including trauma, loss, genetic predisposition, or chemical imbalances in the brain. Both these psychological experiences involve feelings of exhaustion, irritability, and difficulty concentrating. However, burnout symptoms are typically specific to work related domains, while depression symptoms can affect various areas of life, including personal relationships and hobbies. Depression is typically associated with pervasive feelings of sadness, hopelessness, and a loss of interest or pressure in activities. Burnout is typically a response to chronic stress and tends to develop gradually. It may subside or improve when the individual takes a break or addresses the underlying work related stressors. Depression, on the other hand, can be episodic or chronic and tends to last for an extended period, often requiring professional intervention for improvement. While self care strategies and stress management techniques can help individuals recover from burnout, depression often requires professional treatment. Treatment for depression may involve psychotherapy and or medication, depending on the severity and the individual's needs. It's important to note that burnout and depression can coexist or overlap, and individuals experiencing burnout will be more susceptible to developing depression. To counter burnout, having a sense of purpose, having an impact on others, or feeling as if one is making the world a better place are all valuable. Often, meaningfulness can counteract the negative aspects of a job, but burnout in any form can have severe consequences if left untreated. Discussing it openly, either with a spouse, family member, friend, or therapist, is often the first step to addressing its symptoms, getting needed help, and avoiding negative outcomes. To read more on the topic, check the description. Thank you for listening. Keep observing.